Question 1. Who can use a public access defibrillator AED, automated external defibrillator? Is it A. Paramedics only, B. First aiders only, C. Doctors only, or D. Everyone? The answer is D. Everyone. All automated external defibrillators, AEDs, give you easy-to-follow verbal and/or visual instructions. The 999 operator will direct you to the nearest AED if you need to use one. Question 2. You're asked to fetch a defibrillator AED. What's the best way to find the nearest AED? Is it A. Follow the arrows on marker posts. B. The 999 operator will direct you. C. Ask your car's built-in sat-nav. Or D. Check the casualty's belongings. The answer is B. The 999 operator will direct you. The sooner an AED is used, the better the chances of survival for the casualty. The 999 operator will direct you to the nearest AED if it's necessary. Question 3. You're performing cardiopulmonary resuscitation, CPR, on a casualty. Someone stops to help. What should you get them to do? Is it A. Fetch a blanket, B. Fetch a first aid kit, C. Fetch a defibrillator, or D. Fetch a privacy screen? The answer is C. Fetch a defibrillator. A defibrillator, AED, could improve the casualty's chances of survival. Do not stop CPR to fetch an AED, but if there's someone else with you, you can send them to get one. The 999 operator will direct you to the nearest AED if you need to use one. Question 4. You need to use a defibrillator, AED, on a casualty. How will you know how to use it? Is it A. You need to be trained to use an AED. B. The AED gives you visual and verbal instructions. C. You must read the AED's instruction manual. Or D. The casualty will tell you what to do. The answer is B. The AED gives you visual and verbal instructions. AEDs are simple to use. They give you visual and verbal instructions and will not shock a casualty unless it's required. Question 5. You're performing cardiopulmonary resuscitation, CPR, on a 6-year-old child. How's it different to performing CPR on an adult? Is it A. You may only need one hand and press down 4 to 5 centimeters. B. You should press twice as fast, but more gently. C. You should press more slowly but more firmly. Or D. You can only use 2 fingers and press down 1 to 2 centimeters. The answer is A. You may only need one hand and press down 4 to 5 centimeters. When performing CPR on an adult, you should use 2 hands and press down 5 to 6 centimeters. For a child, you may only need to use one hand and should only press down 4 to 5 centimeters. For an infant, you should use 2 fingers and press down about 1/3 of their chest depth. Question 6. You're performing cardiopulmonary resuscitation, CPR, on a casualty. When should you stop CPR? A. When you need to talk to the 999 operator. B. When you've completed 5 minutes of compressions. C. When you want to fetch a defibrillator, AED or D. When they start breathing or a healthcare professional takes over. The answer is D. When they start breathing or a healthcare professional takes over. You should not stop CPR unless the casualty begins showing signs of life like breathing normally, or a healthcare professional takes over, or the AED tells you to stop. You can use speakerphone to allow you to continue performing CPR while talking to the operator. Question 7. You arrive at the scene of an incident. You see a casualty who's not moving. What should you do first? Is it A. Check if it's safe to approach the casualty. B. Begin cardiopulmonary resuscitation, CPR. C. Start looking for a defibrillator, AED. Or D. Move the casualty into the recovery position. The answer is A. Check if it's safe to approach the casualty. The first thing to do is to assess the situation for danger. You need to make sure that there are no further risks. If you go to help and get hurt, then there are 2 casualties. Question 8. You're performing cardiopulmonary resuscitation, CPR, on a casualty. How fast should chest compressions be? A. Once per second. B. Twice per second. C. 3 times per second. Or D. Once every 5 seconds. The correct answer is B. Twice per second. When performing CPR, you should press down hard and fast in the center of the casualty's chest. You should aim for about 2 compressions per second and keep going until the casualty starts breathing normally or a healthcare professional takes over.